we are seeing an increasing number of cases. And this means that local doctors are being able to identify patients in need of a specific medical care. Patients that once before were considered untreatable because of lack of the knowledge, now these patients are being given a second chance.
Estimados colegas de Latinoamérica, Caribe y colegas de todo el mundo, mi nombre es Carlos Luque, director médico de la Fundación ETE y miembro de la Red de Investigación Translacional de Salud del CONICET. En nombre de estas dos instituciones, les doy una cordial bienvenida al primer simposio virtual atópico único del 2022 sobre atresia biliar. Tenemos el privilegio de contar con los máximos exponentes en este terreno provenientes de las 3 sociedades científicas que lideran los avances obtenidos hasta aquí en esta patología. Esto es las sociedades del AASLD, el EASL y Asian Pacific. Aprovecharemos esta oportunidad para presentar ante la comunidad internacional el proyecto de investigación multiinstitucional latinoamericano y del Caribe, que ya cuenta con 33 centros de la región y que hemos dado en llamar Atrevio Atresia Biliar Omics. Atrevio, además de ser un proyecto de investigación concreto del cual pueden interiorizarse aquellos interesados entrando en la cuenta de Instagram del mismo nombre, es una propuesta de trabajo científico colaborativo interinstitucional que intenta nacer sobre bases sólidas que aseguren continuidad y crecimiento. Esperamos que esta propuesta científica entusiasme a muchos en nuestra región. Colegas latinoamericanos y caribeños, tenemos frente a nosotros no solo un desafío científico, sino y principalmente un desafío cultural. Nuestra propia historia nos invita a ser parte de la generación de especialistas que inauguraron una nueva era, la del trabajo conjunto colaborativo que persiste en el tiempo, donde senior y junior ponen sabiduría y vitalidad al servicio de un objetivo común, donde las buenas ideas fluyen en todas las direcciones y no solo de arriba hacia abajo. La comunidad internacional necesita nuestros hombros para cargar la parte que nos corresponde de ese esfuerzo global que busca derrotar la enfermedad hepática terminal que cega tantas vidas a tan temprana edad. We now switch to English, for this is going to be the language in which the whole symposium will be held. Please remember the specific icon located at the bottom of your screen to choose your language preference. I would like to introduce Dr. Becerra. He will give us a short opening speech that will be the official kickoff of this scientific event. Dr. Becerra is a professor of pediatrics and director of the Division of Gastroenterology, Hepatology of Nutrition at Cincinnati Children's Hospital Medical Center. He holds the William and Rebecca Balistrieri Chair of Pediatric Hepatology. He's the medical director of the Liver Care Center. Dr. Becerra studies pediatric liver diseases with a focus on biliary atresia. His approach uses human tissues, clinical data, and complementary laboratory models of tissue organoids and mice to investigate how the immune system and the microbiome injure or protects bile ducts, developmental defects of bile duct epithelium, and predictive analytic to improve diagnosis and treatment. His research is funded by the National Institute of Health. Dr. Becerra is the immediate past president of the American Association for Study of Liver Disease and is a member of the American Society of Clinical Investigation and the American Association of Physicians. Dr. Becerra.
Thank you, Dr. Luque. Good morning, good afternoon, and evening and night to all of you, wherever you are. This greeting actually underscores the transcontinental nature of this research symposium on biliary atresia. The symposium is the end result of a remarkable work by Dr. Carlos Luque, Dr. Josep Maria Argemi, Dr. Guillermo Mazzolini, and Dr. Juan Pablo Arab. I want to congratulate the organizing board for assembling a superb program that brings together thought leaders on biliary atresia. I like to think that today we are living in the future as we have a better understanding of pathogenic mechanisms of the disease. Today, careful studies point already to the prenatal onset of disease. They identify new biomarkers. They now deconstruct the liver into single cell compartments, and they actually model the disease using human biliary cells and organoids. These will be topics of discussion in this symposium. I also want to congratulate the organizing board for the creation of the Atresia Biliary Omics, or AtreBio, which aims to catalyze collaboration among liver groups and liver centers in Latin America and the Caribbean. Actually, this form of forum forms a setting in which ideas can be exchanged, concrete projects can be pursued, and new knowledge can be generated. Investigators in the US know that such collaborative efforts can be very effective in promoting studies of natural history of disease, pathogenesis, and clinical trials. This, for example, is an example that we use in the consortium known as Childhood Liver Disease Research Network, that brings together several centers in the United States. So to end, we all share one goal: use research to improve the outcome of all children with biliary atresia. To achieve this goal, we recognize the notable progress in the field to date, but we also recognize that our knowledge remains incomplete. So I hope that we'll together share ideas and help each other as we begin the symposium. Thank you.
Thank you, Dr. Becerra. Now we are ready to start our quite busy scientific program. Our first session will be devoted to clinical aspects of this versatile disease. We will have three outstanding speakers: Dr. Davenport Mark, Dr. Carpen Saul, and Dr. Jorge Becerra. They will delight us with three talks and a pro-con debate. I request that all speakers keep tight to the schedule, that is 20 minutes talk, so we have 10 minutes for questions.